Significantly fewer tests were conducted over the past 24 hours, just over 26,000. That's compared to over 50,000 a day in the past week. So the numbers are lower across the board. 7,200 new COVID-19 infections nationally, but sadly 221 deaths in the past day. Gauteng remains the epicenter with just over 2,600 reported infections. The Western Cape follows, 1,200 new cases. The positivity rate stands at 27.3%, so it's still pretty high. But I'm joined now by Dr. Nicholas Crisp, Deputy Director General in the Health Department. Dr. Crisp, good evening. Let's start with those numbers. So we know that a lot less tests were done, but even if you double those numbers, it's still quite a bit lower. What's going on? Do you think it's just the weekend effect?
Yeah, good evening, Sally. Good evening to the viewers. It does sound a little bit too low to be realistic, and one was always suspicious when you get figures that don't seem to fit a pattern. So I think we need to follow up what happened. We do know that our weekend figures are lower, but it doesn't account for why these are so low. We'll need to find out why.
All right. Talk to me about vaccinations. There's been a great uptake from the over 35s to the 49s. Fantastic response. Talk to me about how many South Africans have received at least one jab so far.
Yeah, we're very, very happy indeed with the response so far. Things are really starting to come into place very nicely. I've almost lost touch of how many the vaccines there are every day now, because today we did over 223,000 vaccinations, which is significantly up on our previous best before the KwaZulu-Natal trouble started of 191,000. And we, in the first day of the registration of the 35 to 49s, had more than 1 million registrations and more than 500,000 the next day. The numbers are moving very fast now, and that's extremely encouraging. We hope that a lot of older people, when I say older, I mean older than 40, are still coming, and older than 50 and older than 60 are still being vaccinated. We have a number of programs still targeting those age groups. So all in all, things have picked up nicely, and once KwaZulu-Natal is completely back in the swing of things, I'm sure, and Gauteng, I'm sure the figures are going to pick up even more.
Well, that's really encouraging. Over 223,000 jabs in one day, getting closer to that target set by the President of 300,000 jabs a day. So let's talk about KwaZulu-Natal. Were a lot of vaccines wasted or destroyed during the unrest last week?
We did lose some in that had been allocated into the distribution network of the private sector. Fortunately, there wasn't that much in the portions of the supply chain that were damaged. So it has not been too great a loss, and the public sector vaccines are spread over a large number of facilities and were protected. So fortunately, we have not lost much by way of vaccines, but we lost a lot of opportunities to vaccinate people. So if we think we were unable to vaccinate somewhere between 40 and 50,000 people per day between the two provinces, that's the impetus that we lost during this period, and we're just going to have to work harder to make it up.
All right, so that would be about 300,000 vaccination opportunities lost last week because of the unrest.
Yeah.
Okay,
that's
so
about it.
That is significant. Is it Gauteng and KwaZulu-Natal, are those vaccination sites reopened, back up and running at full steam, or not yet?
So in the private sector in KwaZulu-Natal, we lost some vaccination sites. In fact, some people have lost their entire pharmacies that were destroyed. And trying to work out exactly which ones are still able to go is going to take a while to get all the reports in. It's been fascinating and it's really heartwarming that some of the people who run these sites and who've lost just about everything are still coming back to us and saying, send us more vaccines, we want to vaccinate. And sort of that's the spirit of the rebuild that is on the go there. It's extremely encouraging, but yeah, we have lost some of the capacity in KwaZulu-Natal. In Gauteng, it doesn't sound like we've lost much by way of capacity.
I have to ask, and this is for all the under 35s who've got serious FOMO, fear of missing out. They want to know when is it opening for their cohort? When can they start registering?
So I think, patience is going to be the order of the day here. If you think about it, now we have somewhere between 14 and 15 million people available as in what we call the demand part of our formula. That's 12 million people between the age of 35 and 49, and the leftovers of the older people who still need to be vaccinated. So there are a huge number of people in this virtual waiting queue. And I was talking to someone today and saying, do you realize that 12 million people 2 meters apart in a queue is 24,000 kilometers? So it's a very, very long queue, and it's going to take a while to get through. So we are aiming, at the moment, it looks like we're headed for 1 million vaccinations every 4 days. We're gearing up to 1 million vaccinations every 3 days. And if we can sustain that between now and the end of the year, we will pretty much be on top of things. So what we like to do is get to a point where we see the momentum. And remember that the 35 to 49s have not actually officially started vaccination program yet. That only officially starts on the 1st of August. So although some people are coming and taking opportunity of walking into various sites, the real vaccination for that group is really still to get into full swing. We need to give them a bit of a chance to get that momentum going before we consider opening up and announcing a date for the last group.
Ballpark, what are you thinking?
Yeah, that's being speculative at the moment, but certainly by the end of the middle of September, I would guess would be the absolute outside. So it depends very much on how fast we're all able to gear up and whether things continue to run as smoothly as they have picked up again after this period of violence.
Yeah, well, thank you so much for bringing us positive news. Goodness knows we certainly need it, and let's hope that the vaccination program can continue apace. So you heard it, the under-35s. Nicholas Crisp tells you, hopefully, if all goes well, you might be able to register mid-September. It's not that long to wait. 2 months, in fact. Thank you very much, Dr. Nicholas Crisp. He's a Deputy Director General in the Department of Health, also telling us about a record in the number of vaccinations in one day, over 223,000. We are heading for 250,000 a day very, very soon. Such great news this evening.